Welcome back to the Therapeutics Chronicles. I'm your host, Mu'min Wali. And today's episode is one you don't want to miss, especially if you have ever counseled a patient on overactive bladder or reviewed prescriptions for urinary incontinence. We are talking about Mirabegron. It is the first-in-class beta-3 adrenergic agonist that's changed the game for patients who could not tolerate anticholinergics or did not want the dry mouth and cognitive risks. If you're studying for pharmacy board exams or actively practicing retail, long-term care, or urology clinics, this episode will give you a practical and high-yield breakdown. We will cover mechanism of action, dosing strategies, safety monitoring, drug interactions, and the real-world challenges pharmacists encounter with this medication. Trust me, there are more than a few. Before we jump into the pharmacology, do not forget to join our WhatsApp and Telegram study groups. These communities are buzzing with clinical cases, mnemonics, and pharmacy exam strategy sessions. Check the episode description for links. And of course, let's connect on LinkedIn so we can build a network of strong, clinically sharp pharmacists. Alright, let's start with how Mirabegron actually works. Mirabegron is a selective beta-3 adrenergic receptor agonist. These receptors are found in the detrusor muscle of the bladder. When activated, they cause relaxation of the bladder muscle during the storage phase, increasing bladder capacity and reducing the symptoms of urgency, frequency, and urge incontinence. Unlike anticholinergic agents, Mirabegron does not block muscarinic receptors, so it avoids the classic side effects of dry mouth, constipation, and cognitive impairment, particularly important in older adults. In Canada, Mirabegron is indicated for the treatment of overactive bladder, OAB, with symptoms of urinary urgency, frequency, and urge incontinence. It is also often used off-label in patients with neurogenic bladder disorders, though this should be done under specialist supervision. Now, let's talk dosing and administration. This is where pharmacist precision really matters. Mirabegron is available in extended release tablet form. The usual adult starting dose is 25 mg once daily. After 4 to 8 weeks, if the patient is tolerating it well and more efficacy is needed, the dose may be increased to 50 mg once daily. It should be taken with or without food at the same time each day. But here is the nuance. In patients with severe renal impairment, eGFR 15 to 29 milliliter per minute, or moderate hepatic impairment, Child-Pugh Class B, the maximum recommended dose is 25 mg once daily. It is not recommended in patients with end-stage renal disease or severe hepatic impairment. Also, it should be swallowed whole. Do not crush, split, or chew. Pharmacists must ensure this instruction is crystal clear, especially for elderly patients or those with swallowing difficulties. And let's not forget, it takes several weeks to see full benefit. Patients must be counseled not to expect overnight relief. Now let's move on to safety concerns and pharmacist knowledge. One key adverse effect is hypertension. Mirabegron can increase blood pressure and heart rate, so it should be used cautiously in patients with uncontrolled hypertension. Blood pressure should be monitored periodically, especially during dose escalation. Other common side effects include urinary tract infections, headache, and nasopharyngitis. Rare but serious effects include urinary retention, especially in patients with bladder outlet obstruction or those on anticholinergic medications. Also worth noting, QT prolongation has been observed at higher than recommended doses, so co-prescribing with other QT prolonging agents should be done with caution. Mirabegron is a moderate CYP2D6 inhibitor, which means it can increase the serum concentrations of drugs metabolized by this pathway. Think metoprolol, desipramine, and certain antipsychotics like risperidone. Pharmacists should double-check potential interactions and consider dose adjustments or enhanced monitoring. Now, let's walk through some real-world cases where pharmacists caught or corrected issues with Mirabegron. Case 1. A 78-year-old woman is prescribed Mirabegron 50 mg for OAB. You notice she has a history of uncontrolled hypertension with recent readings above 160/100. You call the prescriber, discuss the risks, and a decision is made to defer Mirabegron until her blood pressure is better controlled. Case 2. A patient fills Mirabegron 25 mg but comes back a week later frustrated that nothing has changed. The pharmacist counsels on expected onset, explaining it might take 4 to 8 weeks to full effect, and reassures the patients about the timeline, improving adherence. Case 3. An elderly man on tamsulosin for BPH is started on Mirabegron by his urologist. You review his profile and discover new symptoms of incomplete emptying and dribbling. Recognizing the risk of urinary retention with combined therapy, you flag the issue and coordinate a follow-up with the clinic. Case 4. A long-term care patient on Mirabegron is prescribed metoprolol. You perform a medication review and notice elevated pulse and mild dizziness. You notify the prescriber and suggest monitoring or dose adjustment due to possible CYP to D6 interaction. Case 5. A caregiver calls to ask whether Mirabegron can be crushed for her father who has difficulty swallowing. You explain that the extended release formulation must be taken whole and coordinate with the provider to explore alternative treatments or supportive swallowing techniques. Let's pause here to remind everyone that our university platform is the perfect tool if you want to master medication safety and case-based learning. Whether you are prepping for PEBC, OSCEs, or improving clinical decision-making, we have got you covered. And don't miss the study groups. Telegram and WhatsApp links are in the episode description. Now, let's run a quick dream counseling simulation for Mirabegron. Remember, DREAM stands for directions, reason, expected onset, adverse effects, and monitoring. Pharmacist. Hi, Mr. Rogers. I see you are starting Mirabegron for overactive bladder. Here is how you will use it. Take 1 tablet by mouth once a day, at the same time every day. Swallow it whole, do not crush or split it, and you can take it with or without food. This medication helps your bladder hold more urine by relaxing the bladder muscles. You will not feel improvement right away. It usually takes a few weeks, so be patient and consistent. Some people experience high blood pressure, urinary tract infections, or headache. We will keep an eye on your blood pressure over time. Let us know if you feel dizzy, have trouble urinating, or notice any unusual symptoms. It is important not to stop this medication suddenly unless your doctor tells you to. If you miss a dose, just take the next one as scheduled. Any questions? And now, let's reinforce your learning with our rapid-fire Q&A segment. Question 1. What's the mechanism of action of Mirabegron? Answer. It is a beta-3 adrenergic receptor agonist that relaxes the detrusor muscle. Question 2. True or false? Mirabegron can be crushed for easier swallowing. Answer. False. It is an extended release tablet and must be swallowed whole. Question 3. What is the expected time to benefit with Mirabegron? Answer. Typically 4 to 8 weeks. Question 4. What key CYP enzyme does Mirabegron inhibit? Answer. CYP2D6. And that wraps up our session on Mirabegron. We have explored its pharmacology, clinical use, dosing, side effects, interactions, and even handled some tough pharmacy cases. If this helped you become a better informed pharmacist, do me a favor. Subscribe, share it with a colleague, and jump into one of our study groups today. This is Mu'min Wali signing off from the Therapeutics Chronicles. Catch mistakes before they catch you. See you then.